Western civilization is moving closer to a point of irreconcilable, unstable equilibrium, as frighteningly increasing numbers of people trust nothing. Media, academia, and especially the governments are no longer held in high esteem. Regaining trust is often impossible after betrayal. However, transparency is essential to any healing process, and that is the essence of the Don Sullivan Show. Please listen to the team explore, probe, and debate cutting-edge science, technology, and computing. Play ball! Hello, folks. Hello again, and welcome back to the Don Sullivan Show. As I say every time that you are on, the wonderful, loyal audience that you are, that this is the show that talks about science, technology, and computing in the most casual, informal way that we can, and in a way that the average American teenager can absorb everything that we are discussing. And of course, there is an enormous variety on the Don Sullivan Show. We take you up mountains, we take you to the bottom of canyons, we take you into the depths of the worst diseases that there are in America and the world, and we talk about artificial intelligence. I really do like to spend a lot of time talking about medicine, though, especially in this year of 2025. And not medicine from the perspective of the disintegrating healthcare system, at least financially in the United States. Not medicine from the perspective of me being, well, in really good shape, but needing a lot of different medical attention, which we're going to have a significant number of episodes on in the future. Wait for them. But today we're going to talk about something that is somewhat academic and is very interesting in a way that I don't think much of the audience, really has ever looked at it before. We're going to look at orthopedics and physical therapy and the need for everyone to consider their orthopedic health. And that is not something that you out there in the audience have ever done. You audience that is younger, you haven't done it, and your audience that are your parents or your grandparents, they haven't done it either. You know why? Because the only time you really consider orthopedics is when you get hurt, which is not the best way to go about it, and I don't know how it evolved that way. But we today are going to talk with my guest. Our guest, Steve, is here with us. I'll have Steve introduce himself in a second. But Brad Marquez has been around this particular industry, the physical therapy and kinesiology industry, orthopedics as a header, for better part of 40 years or so. And he is an absolute expert. He is my physical therapist. He is responsible to a large extent for me still being able to get up to the highest mountains and down to the deepest canyons. And he is also responsible for beating me up a lot, but in a way that makes me a lot better and a lot stronger. So he is now the owner and the purveyor, the CEO of PhysioPractex out of Littleton, Colorado. And I would like you all to say hello and say hello to the audience, Mr. Brad.
Hi, Don. How are you?
Hi, Don. He's just looking at me like, oh, I don't know where this is going.
I'm scared already.
You're a lot more submissive when you're in my office. I know. I'm scared already. All right, Steve, take it away.
From the Garden State, today's episode is brought to you by License Fortress, the industry's first and only software asset management firm to offer both a financial and legal guarantee at its highest level of service. Whether it's Oracle, Microsoft, or VMware, License Fortress helps organizations stay compliant, avoid audits, and save money. Learn more at licensefortress.com. And please support our producer by visiting axtinc.com. That's AXTINK.com. Subscribe to his YouTube channel and help support his efforts to create humorous animation. And finally, win his family back disguised as an elderly, eccentric female nanny. Back to you, Don.
Something different every time. Sometimes I think you make this stuff up, Steve, and I know him well, so sometimes I think you don't. So I don't know.
We talk every day, and he's a troubled person. I don't know.
Okay. But he keeps doing good work for the Don Sullivan Show, so I can't complain, you know?
No, absolutely.
All right, Brad, let's get into this discussion. So you and I have engaged in countless hours of commiseration pertaining to the state of physical therapy in general. Most of the time when I was in a state of distress of one kind or another, so I'm not sure I remember everything. But most of that conversation in general has been focused on, you helping me and nursing me back to health from one thing or another that's happened. I always Well, I like to say I'm a perfect example of ex-jock syndrome, that everything hurts and you really can't determine root cause. So you just got to kind of deal with it as you go along. And of course, I'm 63 now, so I still like to pretend that I can still do things like throw baseballs really hard and do lots of other stuff. Brad does warn me about doing too much constantly, which I too often ignore and then have to go back to Brad for more. But it works out really well for both of our things. But Brad is very much old school. And old school, I mean the 90s or maybe the 80s. In other words, when physical therapy was actually like training for a sport, as opposed to just making you feel better and massaging your feet and then giving you a Xerox paper to say, go home and do these stretching exercises and come back in 3 months and maybe you'll feel better. Brad works on people to make them healthier. And this is a general overall issue, as I mentioned at the beginning of the recording, when it comes to orthopedics in general. People here in America, especially and beyond, do not consider their overall orthopedic health. It is a strange situation that everything we do in medicine, we have preventative assessments, except orthopedics. Of course, we have orthopedists euphemistically handing out business cards at the bottom of ski slopes when things happen, but we don't generally look at, other than occasional bone scans if something is extremely clear that's a problem. We don't spend a lot of time really thinking about any of these things until we get hurt. So, Brad, why don't you tell us here, and I'll stop ranting, what really is the job of a physical therapist, and compare 30 years ago to today, if you will.
Well, the definition is we're trying to identify musculoskeletal injuries, deficits, and try and help you optimize your health, decrease your pain, improve your function. We're like you said, it's evolved from. It's got quite a history. It's evolved from basically hospital-based procedural medicine to trying to enter the athletic realms, and now they're calling it evidence-based practice, doing a lot of research and trying to use that research to prove that our treatments are effective. We can get into a lot of critical thinking there.
I can help with that.
Yeah, exactly. How much do you take one study and claim it's studies show that this is effective? Well, let's talk about the validity of said study and the population it's been studied through, and et cetera, et cetera. But we, as you and I have touched on many times, I think that the physical therapy needs to be more than exercise. It needs to be more than massage, more than exercise. Unless you get your hands on people, treat them manually, you'll never know what is truly wrong with them.
I like the massage part.
This is a kind of a different massage.
That's what you got.
You might be thinking of there, Steve.
Right.
For example, I'm going to have a elbow surgery, which we will have a number of Don Sullivan shows on. And I have a problem in my ulnar nerve. It's called cubitus tunnel syndrome. And Brad can massage my elbow, and as he did the other day, make me jump through the roof continuously, right?
Mm-hmm. Yeah, it's a lot of fun.
That's necessary. Because it's necessary because it's how he is working out all the bad stuff that's in there that is causing me to lose significant strength all the way down my arm into my hand, which is why it has to be operated.
Right.
Sometimes that can be uncomfortable.
Mm-hmm. Even pre-surgically, we have goals. Let's loosen up the tissues around that. Hopefully, the surgeon it'll be looser for the surgeon to do his job more effectively. Hopefully, we'll decrease some of your symptoms before you even get to surgery.
Yeah, as I said, I don't want to get into this too much because we're going to have entire shows on it. But right now, my ring finger and my pinky finger, my right hand, are borderline useless. I can't even write my name. Interestingly enough, I can throw pitches because you really don't use those fingers unless you're trying to really throw real pitches. But my overall mechanics are pretty good.
Right.
So I can actually get the ball out of my hand and throw to the 6-year-old that's around the other side of the yard. But otherwise,
Who needs a little finger?
I can't pick up my phone or I can't hold it or very, very long. And Brad discovered this really in 2019 or early 2018. And we've been working on it ever since, but it's really got to a point where it's a problem. So, Brad, how and why has this changed over the last 30 years? And I'll give you an example to start with. When I first had my first major knee injury, which was a full knee, left knee, in March of 1993, they actually put me through 8 weeks of physical therapy before the first surgery. And then literally a year more and then a second surgery, and then another 6 months after that. But it was 3 days a week. And it was 3 hours, and it really was the intensity of training as a serious athlete. And now most people are they don't do much.
Right. Nobody devotes 3 hours of time to one individual anymore. It's cost ineffective. And then also we can argue the things you've alluded to is how much expertise is going into said 30 minutes? Are you getting a very young PT who's got a different viewpoint of what physical therapy is than a grizzled old veteran like myself?
Yes, I'll use the word clueless. Brad is being a lot more polite. Yes, I've mentioned many of them. And those of you out there who aspire to be in this field, please don't take that personally, and please don't be like that. Go ahead, Brad.
Sorry, say that again.
Go ahead. What is the main issue here is that where is the balance? And I did describe to you a situation in 1994, which I described it very, very accurately, in which they were putting me through a lot of exercise. They obviously weren't doing hands-on work with me for 3 hours, but they were having me do all these exercises to regain the strength in my leg. And back then I was 32 years old. I was still running and I was pretty strong. And so I was doing a lot. But they were spending a good 30 or 40 minutes of those 3 hours with me, working, massaging. I had tremendous swelling and so on. But so, I mean, other than just being cost effective, or at least the economies of scale, and we won't try to blame the whole private equity model too much, but is there any medical legitimacy for the minimization of it all? Or is this really just an unfortunate maturation or an evolution in the industry?
Oh, that's a tough one. Theoretically, I would say this field still wants to be viewed as a leader in this type of medical treatment. But you and I have talked multiple times about the fact that it's only becoming more ineffective. So I have a hard time saying that that it's just a progression. I don't think they want it to go that way. But
Who's they?
They meaning the field, the schools of physical therapy
are no between the physical therapist versus the insurance companies running the whole thing.
Oh yeah. No, the physical therapists would love to continue to be industry leaders. The reimbursement industry, is that what you're referring to?
Yes, I guess I am.
That's another can of corn.
You're trying to cut to the chase here.
I try not to name companies that aren't sponsors of the Don Sullivan Show, but we all know who we're talking about.
Right.
I don't have any health insurance sponsors to my knowledge.
We're working on it.
Here they come, everybody. All the biggies down your row.
I think part of I want to go back to the theme of this episode, which is that orthopedics in general is not thought of in a preventative, from a perspective
Right.
of a preventative paradigm. And that includes
Oh, yeah.
post-injury. So before any injuries and then after an injury so that they don't get worse and happen again. Neither one of those focuses have, I think, improved or gotten better. It's just totally reactionary. Am I right at this moment? For the most part in the industry.
Correct. The general viewpoint does not look at preventative medicine. In fact, Medicare, if we're going to name any names, has requested that we do not use the word preventative or maintenance. So therefore, we're automatically subjugated to immediate treatments for injuries only.
Yeah.
And once Medicare...
Totally reactive.
Totally reactive. Exactly. Yeah. Once Medicare makes a determination, then most likely the major carriers follow suit.
Yeah, well, that's certainly the case with drugs or pharmaceuticals, with the pharmaceutical benefit managers and everything else. It basically, Medicare gives them license to run things however they want, as long as it's according to what Medicare has determined.
Right. Whatever their guidelines
from a financial perspective
are.
with the
Yes.
with the corporate monopolized insurance companies.
Mm-hmm. And in the case of the elderly, you don't even worry about so much improvement. Your focus is on returning to their former level of ADL function, activities of daily living. So really the goal isn't even to improve somebody, it's just to maintain or return them to this function.
And this is where it's broken off into occupational therapists as well as physical therapists, right?
Correct.
Yeah. So now, other than with patients such as myself and other dedicated athletes who really want to maintain that after their real athletic careers are gone, we had an episode a number of weeks ago, Leon the Bionic Man, who has had literally 3 total professional careers in athletics, and he's right now, just to give you audience an update on Leon, he is he had to have his foot completely rebuilt, and he's in a cast for 3 months right now, but he'll be back on to talk about that too. But other than people like us, Brad, what really needs to be done with them when they first come in before an injury, and then after they've had some kind of treatment, very often resulting in a surgery of some kind? What needs to be done afterwards that's a little bit different? And you have so many, and the reason I ask you it that way, it's a very broad question. You have so many tools in your intellectual toolkit and your approaches, whether everything from chiropractic, which you're expert in, to the rather unpleasant but effective treatments of dry needling and what is kind of like high-end intense acupuncture, but mostly physical manipulation. And I'm going to get into some examples here that we're going to talk about, which are miraculous. And then afterwards, what can you do within the limits of what has been imposed upon you to make people the most healthy? And then what should they do to try to help you make them better?
We should probably go back to that initial statement about preventative medicine and trying to change the mindset of we need to treat you as an entire entity. We can't just treat an injury. You've got to look at you globally. And so that's the first thing I would like to see changed in this mindset of becoming better at what we do.
Would you use the word holistically?
Holistic, absolutely. I mean, I believe in starting with the framework, i.e. your skeleton, making sure you have the correct balance and mobility, full mobility of your skeletal frame. Then you can start working out to the range of motion. Then you can start trickling in the strengthening and flexibility. So that model, if we could teach that to everybody, that we're not just treating a body part, we're treating you holistically, then that model will become much more effective.
Do you think the trend toward... Oh, I'm sorry, Brad. I was just going to say, do you think the trend towards specialization has kind of had a negative impact, towards what you're describing?
Absolutely. I think it's great in theory that somebody's going to be very good at one thing, but you lose the big picture of, you can't treat somebody globally if you're only an expert in one small subsection. I'm like Don was alluding to, we're old school. I like a big toolbox. I don't want just two tools. I want a big toolbox. I want to be able to draw from multiple disciplines to be able to really be effective to people. And even if I'm going to talk about my friends in the chiropractic field, I mean, the best chiropractors, in my opinion, are the sports medicine faction, because they also integrate this sports mentality and use the PT modalities and tape and all of that mindset to help their clients. So there's really a wonderful blend in that lane, and that ilk of clinician also tends to look very globally at the person's health.
So there's so many examples here that I can give. And again, I'm obviously on this show very open with myself, because there's a lot of examples that come from me from a long period of time and a lot of different experiences. But just as an example, and you can comment on this, Brad, along these lines, that it was just a few weeks ago, and I'm not going to get into the details of this because we will have future shows on it. But I have a couple of internal problems that you actually fixed inadvertently, or at least you relieved the symptoms of inadvertently for a short period of time without even being aware that you were doing it, by within the context of exactly what you were just saying, working on me from the perspective of my overall body. You constantly look to see initially whenever I visit as to whether or not my alignment and my spine is right, and usually it's not, and then work on my range of motion, sometimes it being somewhat unpleasant, and and then really stretch me to the limits that are sane and possible and healthy for me. And obviously that range of motion does the trick. And do you remember the one time I walked out, and about a little later that afternoon, I told you whatever the internal symptoms that I had amazingly gone away? And that fits that example.
Yeah. As long as I don't create any further injury, we're achieving all of our goals, right? Our maximization goal.
Well, and I'm really, what I'm kind of getting out there is the fact that when you do approach, and this is a very Asian Oriental, from the old school way of thinking, way of looking at things, as opposed to the Western approach of vertically examining very narrow channels and disciplines. So often is the case, one doctor will give you a medication that another doctor doesn't know about. And another example with me is I was asked years ago, because of bone density problems, to take calcium supplements. And then a few years later, I was determined, guess what? I have kidney stones. Stop taking the damn calcium supplements.
Those are the worst.
Right? And I still do. So that's not the problem that Brad dealt with before, but that might be in the future.
Definitely not one I'm going to help you with.
Yeah, we'll see that. Yeah, you don't know that is the point. The point is when you work on me from that holistic perspective, when you work on all of your patients, some of whom are less willing than I am, I suppose most of whom are, they will benefit tremendously from that broad to starting from the whole body perspective into looking at the individual problem whatsoever. And that is something that, to a very large extent, from what I've seen, and I've been to a lot of physical therapists other than you, unfortunately, over many, many years, that is not common anymore to look at. Oh, you got a problem with your elbow. Let's rub that around. Let's look at it. Let's do exactly what the doctor said on the prescription. And then ask you very politely if there's anything else I can do, hand you a Xerox sheet of exercises to do, and see you in 3 weeks, right?
Correct.
I'm assuming from a musculoskeletal, in terms of muscles in your skeleton, like issues in one area can impact issues in another area pretty easily. Is that fairly accurate?
Absolutely. It's not only accurate, it's fact that quite typically I treat a kinetic chain. Say you have a knee problem. Well, I'm really finding the problem in your sacroiliac through your hip that is affecting your knee. And then in turn probably will eventually affect your ankle and foot. Now, whether it's neurological or musculoskeletal, it doesn't really matter as long as we're identifying that kinetic dysfunction. Then we can start drawing the dots, right? And that's when you start to become a really good PT, is when you're finally connecting dots through multiple places.
And this is a perfect segue, Brad, for exactly the points that I want to get into here that are practical. For example, you see somebody come in and their hip hurts. And when you look at them holistically, you might be able to notice that their real problem is in how they're walking, and send them to a podiatrist to get some kind of implants or even orthotics, right?
Yeah, absolutely. Orthotics, or say we're going up the chain. Maybe it's a problem. Certain parts of the body always dance together. One of the hardest things I do is trying to tease out whether it's a sacroiliac issue, lumbosacral issue, or a hip issue. And you really, it's difficult to tease this part out until you've had some time with either success, right? Success at either the hip or the back.
Most things you see ultimately either come from or go back to the spine.
Correct. That's my personal belief.
Yeah. And that is the reason why, for example, with me, and again, I do want to encourage the audience, especially the audience that lives in the Denver area in Colorado, to seek out PhysioPractex. Even though PhysioPractex is not an official sponsor of the Don Sullivan Show. At the moment, we're working on that too. But still, for your for your own health and for the betterment of your own personal situation, that approach is absolutely amazing. But let me get into some more practical things right now, Brad. And I want to ask you one question in 3 different parts. And they are, what are the most common things that you see with younger people and older people, but with younger people, distinguish between those who are athletes or pretend to be and those who are not? Start there. At people who are younger, say 35 and younger, and not athletes. What's the most common things you see there? And you can even talk about injuries that they're lying about when they had injuries in sex or something like that. Go ahead.
Clarify your question. The question is, what injuries do I see?
People who are younger than 35. What's the most? They aren't athletes. What's the most common things you see with them?
Well, I don't mean to disrespect your age difference here, but frankly, we've just identified that I treat issues of the spine first. That's kind of non-age specific. I find that from 80 to 90-year-olds to 3 to 5-year-olds.
Wow. So it really is interesting. The same.
Absolutely. It's not an age dependent thing. It's truly just the way the body works. The problem with the easy thing with the younger generations is they're more pliable. They frequently can get them, once we steer their body back towards a neutrality, their bodies take over. And their bodies will just naturally, especially anybody who's got an element of strength and fitness, their body will just clear it out. Whereas 40 and above, we have to work on things for a while. We have to start
longer.
identifying where you're too tight, where you're too weak, where you're too dysfunctional in some postural pattern in your life or some habit in your life.
Here's one. Do you find that it's a bigger issue nowadays with people hunched over laptops and phones for work? Is that that's not great posture in general?
You're a genius. That is, look at that. Look at the world you guys have lived in. This IT world. It is absolutely the worst environment to just be seated 8+ hours a day without any postural break. And no part of sitting postures is healthy for you.
Oh, and the breaks include people then going off and looking at their phones while they're on break.
Correct.
I do get up, I walk around. One time we bought those balls that you sit on because you have to balance yourself, but that gets old. That gets old fast because it's like
right. One of the greatest inventions of all time, which I had thought about 40 years ago, not having any financial way to move forward with it, was a standing desk.
We've got one of those.
Oh, they're fantastic, but still limited, right? No matter, even if you're in a standing position, you're still somewhat forward head posture. You're still somewhat rounded shoulder posture because you're working over your keyboard. You're still
you can't type with your chest out like Arnold Schwarzenegger.
Oh, exactly.
You're rounded.
Now they're adding treadmills to your standing desk. Well, that's
it's something.
Exactly. It's every little thing helps. But
I'm just thinking to myself, I can type anytime I want. What's wrong with you?
Destroy my enemies. Yes.
I'm going now to the bathroom. I'll be back. All right. That's really bad. I know. I apologize to the audience. Please, Brad, continue.
Hollywood is not your future, Don.
We'll stick with the podcast.
Not for impersonations.
Your animated voice.
You're talking to me.
You got it nailed.
Perhaps for other gifts, Now, Brad, I want to know, Don mentioned this before. What is dry needling?
Dry needling is the application of an acupuncture needle into dysfunctional muscles or tight musculoskeletal tissue. So it is a somewhat of a bastard stepchild of acupuncture. There are many philosophical differences where acupuncture is considered Eastern medicine. Dry needling is taken more of a Western medicine tact. Application is completely different.
It hurts more.
Why?
A little more invasive, yeah. So again,
what's the theory
practitioner can be light or heavy, depends on your individual, but I think it's an extremely, extremely good technique. One of the few that's come around in my generation of PT that really had teeth. It's really effective for multiple things.
I've never had acupuncture, and I know this is, you mentioned it's more of a Western approach. It's different, but what is the theory behind it, or what does it do for you?
You want me to go into medical detail?
Yeah, maybe just at a high level, what does putting the needles here do for you? I'm curious.
So theoretically, the insertion of a needle is the target zone is where the muscle meets the nerve. Those two structures communicate through a series of chemicals. And what they theorize is either the chemicals are dammed up or they're not producing, one or the other. And somehow the application of the needle through this junction, which there are billions of them in your body, you hit a majority of them, changes the pH of the environment, and all of a sudden we get a blink and your structures kind of wash out and start communicating again. A good analogy is when your computer gets glitchy. What do? You reboot, right? And then miraculously our computer is no longer glitchy. So this is the musculoskeletal version of getting rid of your glitchy.
So is it hitting the nerve, or is it like in between the nerve and the muscle?
Well, you're hitting regions. So you're trying to affect
Gotcha.
as many of these trigger points as possible. So some techniques they call it pistoning, moving the needle up and down. Some techniques are spinning the needle. Other techniques, which are more acupuncture-like, is insertion of a needle, leave it to just kind of let the chemical change of even one application change the environment. I think they all have various benefits. Speaking of multiple tool usage, why certain therapists like one way, certain love the other. In my viewpoint, why not use all of them?
Yeah, more the merrier.
So it does, and I've experienced this, often cause those muscles to go into immediate spasm as well.
Correct. When you really hit the jackpot of a dysfunctional unit, you will get an
That's not
involuntary.
the word I use, but go ahead. Yeah.
You get an involuntary spasm. So when you can get a muscle to jump, this person will feel better. It's not pleasant.
Just to be clear, not right at that painful, moment, but eventually. Yeah.
You're over the target when
correct. You are releasing the system. And for 24 hours, you're usually fairly sore. In
can you use electricity for it? Does electricity get used in anything like?
Yes, that's another application is placing electrical current through the needle once it's inserted into the muscle. Some people feel like that's the most effective treatment form. Yes. I really like that for spastic muscles that are just not giving up, even with traditional attempts at dry needling. Sometimes you just wear the muscle out. You just provide an involuntary current contraction, and eventually the muscle is just like, okay, I'm done. I can't work through this anymore. So start the healing. Let the healing begin.
Yeah, I've had massages where the next day you're pretty sore. When you go to somebody who's doing deep tissue and is trying to make things move properly, it's not really a spa thing. It's more of
absolutely not. There's no feel good moment, right?
No, we're going to get you tuned up properly type of deal. And the next day you're like, oh my God.
It's a masochistic mentality, right?
Yeah, I see a lot of value in it too, though.
Right.
Because it really does, even with the neck.
To that as well, that it's not always fun, but usually the best outcome is through the pain.
Yeah, it's certainly a mix there. Now this is a tangent. You go, Don.
No, I was gonna just reiterate the point that none of it is at the moment pleasant. Even something as mundane and obvious as stretching and trying to retain or reestablish the range of motion that you had before an injury or before you were 60 years old. But it works, and it works 100% of the time to some extent if you do it in earnest. And you go ahead, Steve, because I got a couple of questions I want to sort of end this up on that are overly simplified.
What that brought to mind to me, and this is different from what I was going to ask, which I will, was, if you only seek comfort, I think pretty quickly you'll become uncomfortable at the end of the day. You need to seek out discomfort sometimes, but
nor can you bury your head in the sand. You just can't ignore this.
Question. Once, on YouTube, once in a while, I see these videos of these, I don't know if it's Russia, it's some other country where they're trying to align somebody's back, but they're literally using like a hammer and what looks like, what is that? Do you know what that is?
That's Russian for you right there, man.
and we embrace
suffering. Suffering is good stuff.
Is that a special type of like chiropractic or something? What is that? Or is this just crazy Russians?
That is shock value. Almost
physical therapy school of Joseph Stalin.
that cannot be helpful. My personal opinion, that cannot be helpful in any way, shape, or form.
You will go to
this is not
Gulag
a
now.
legitimate
Gulag for you.
This is not legitimate therapy when they're kind of, it looks like they got like
No,
a
that is
stake
not.
and a hammer and they're
Right, no. You give me
Okay.
the risk reward ratio for that one.
Strong like a bull. Yeah, okay.
Strong like
That's
bull.
all I had.
Now paralyzed in hospital.
Many more. You get east of Moscow. There's lots of them.
Enough vodka, you can fix anything.
That's right.
And by east of Moscow, I don't mean east of New York City today, Moscow on the Hudson, but it's a different story. I digress. So, Brad, let's talk about something overly simplified. If you get somebody to come into your office, so former athlete, 35 years old, it's got some kind of knee pain, and it's really pretty average stuff. What is it? And I'm not going to ask you what is it that the insurance companies will let you do. What is it, and how long should it be, do you think, in terms of their own work, the amount of work they do per day, the amount of times that they see you? And this is an overly simplified, almost disrespectful question. How long should they take to feel appreciably better that they can move along? Say they're 35 years old in relatively good health.
Don, there's no way to answer that question.
I know, but that's why
every individual their body has to tell me how long it's going to take. And it's 1,000 factors of how bad are you? How severely deconditioned are you? How much attention can you pay to your own internal clock to help? The best outcomes come with people that are proactive with their own health, even if they don't know much before I've educated them. The answer is the more you put into it, the more quickly you will heal.
There you go. So I asked this question, which was a ridiculous question because that was the only answer, and I knew how you were going to answer it. Mostly because those folks in the Don Sullivan Show audience who have listened this far need to hear exactly that. When it comes to, and I will say this, the present generation, they really have a significant lack of patience and a lack of willingness to put in the time that's necessary. And I'm about to give a Don Sullivan Show cliche here at the end of this to explain that point. In other words, everything is different, and you really do have to analyze and assess the situation as it is and take the appropriate action that way. And you cannot go in and say to Brad Marquez in PhysioPractex or to any other major medical environment, a physical therapy or chiropractor or anything really, and say, this is what I have as a prescription. I expect to come out of here with a specific result at a specific time. It doesn't work that way. So I set that question up specifically because I knew how you answer it.
Mm-hmm. I thought you were going to give us a Beatles quote, but
we are.
Okay, fair enough. We are kind of an instant gratification society, though. People are
impatient. And people have a hard time being patient while their body heals sometimes, even with the best intentions and hard work.
Sometimes so, Brad, where's all this going? Where's this go? Where do you think? Do you think the medical industry is going to wake up at some point? I mean, government involvement or not, Bernie Sanders' national healthcare system, Medicare for all, or complete Bobby Jindal, free market across the country, like an American thing. Well, regardless, do you think that the medical establishment will eventually wake up and realize the preventative and post-event future preventative value of this kind of hands-on training? Do you think it will happen? Do you think it'll get anywhere back to the way it was 30 years ago?
Not without help. Unfortunately, help has to come in the form of them realizing that this would be the most cost-effective way to approach healthcare.
We've talked about this. The ROI seems incredible in terms of...
It would be, but nobody sees it that way any longer.
You see somebody
And
coming in.
evidence-based practice sometimes becomes so highly specialized. Steve, you had alluded to this, that we become so narrowly focused on certain things that we lose the global picture now.
I was talking to my big toe doctor about that the other day. Some people see a foot doctor. I see one for each toe. It's getting nuts out there.
Well, we're looking at your big toe doctor, who definitely needs to go and look and say, you know what, we're going to have surgery.
He went to
in that
school
big
for
toe.
2 decades for this big toe stuff. He knows his stuff, Don.
2 decades is going to be on that big toe. And you know what, though, Steve? If you do proper physical therapy, flying out from New Jersey to Colorado once a week, and Brad works on you, that will put off the next big toe surgery by 5 years. Don't tell me that's not a value.
Just going out to Colorado to see you is physical therapy for me. I'm huffing and puffing. You're dragging me up hills, but I concede that probably would. And my big toe
maybe
is
Don
fine.
will bring me to New Jersey, and I'll bring my needles, just so you can finally experience the love and affection that needles will bring.
I got to go to
We'll
a
put the dog
Springsteen
upstairs.
concert.
Yeah. Dry needling and Springsteen. I like it. As long as we can get some pizza involved, it's a date.
It's a date.
Well, folks, I think on that note, and that cheery note, I really want to thank Brad Marquez. I want to remind you, especially anyone in the Denver area of Colorado, to look up Brad Marquez. We can give you all of the information for PhysioPractex. As Brad expands this incredible practice of his, I've been with him for 10 years, and he quite honestly is in that top group of people that are the reason that I can put on shows that have me climbing up the highest mountains and into the deepest canyons, and they're going to get higher and deeper as we go on in the next couple of months. But I will tell you this, and we're going to be done with this show here in a second. And in fact, Steve, you want to say so long to everybody until the next time?
Absolutely. Thanks, folks. And thank you, Brad, for coming on with us. Absolute pleasure.
Thank you, Steve. Thanks, Don. Appreciate being here.
Thank you. Thank you, Brad. Thank you, Steve, again, as always. And as I've said, and as we set up in a question about 5 minutes ago, that when you come into physical therapy, when you come into a doctor with a situation that you're not really sure of exactly what's going to happen, you have to be open-minded enough. You have to address that particular situation and that physical condition in a way that is completely unique to the circumstances surrounding it. In other words, folks, even in the most difficult times of your physical therapy and of your medical situations, you must remember, always remember this, that all at-bats are situational.